pulse oximeter or ABG, which one tells the truth? When a patient is struggling to breathe, you need accurate data fast to make life-saving decisions. However, relying solely on that little red number on the finger might lead you astray in critical situations. Let's look at why the screen doesn't always show the whole story. SpotO2 only measures oxygen saturation in the hemoglobin, providing a limited snapshot of respiratory function. In contrast, an arterial blood gas, or ABG, reveals the complete status of oxygen, carbon dioxide levels, and acid-base balance. It is the gold standard for understanding how well the lungs are actually exchanging gases at the cellular level.
Always remember this critical nursing insight. A normal SpO2 does not rule out dangerously high carbon dioxide levels in your patient. Always prioritize your clinical assessment and use an ABG for a definitive diagnosis when respiratory distress is suspected. Think of SpO2 as a quick screen, while the ABG remains the full picture.